Coronary artery disease is expected to be the #1 killer in the developing world by 2020. Over 1 million people live with rheumatic valvular disease in sub-Saharan Africa, compared to 37,500 in the whole of the industrialized world. An increase in the occurrence of these diseases has also become evident in central South Africa. However, it is not only affecting the adult population. Professor Stephen Brown from the Department of Pediatric Cardiology at the University of the Free State elaborates.
In contrast to general belief, heart disease in children is actually a lot more common and prevalent than one can imagine. In pediatrics, we are actually dealing with two groups of children. The vast majority are the so-called congenital heart diseases. Essentially what it means is that these are children being born with a heart defect. On the other hand, in our communities and in South Africa in particular, we have a major problem and a burden that we face due to rheumatic fever and rheumatic heart disease. It seems to be quite common in our population. It's a disease that is essentially preventable. And the sooner we can diagnose it, the more we can offer for children suffering from rheumatic heart disease. Everything comes down in the end to recognizing defects in a newborn. Quite simply put, they most likely die somewhere out in the community not being recognized. And the problem is that we have everything available to treat and diagnose these children, but we need people in the periphery or there at grassroots level to actually recognize that there is a child with a heart problem.
Additionally, lung-related diseases count amongst the top 5 cancer killers in South Africa. Research indicates that only about 1 in 10 patients requiring chest surgery in central South Africa actually received the procedure. Dr. Johan Jordan from the Department of Cardiothoracic Surgery at the Free State University provides more information.
In the last few years, we've been experiencing an increase in lung disease in the central South Africa. It might be related to the increase in HIV, but what we have been seeing is an increase in lung cancers, the increase in tuberculosis, and an increase in infective lung disease. And this is related to an increase in the mortality and morbidity overall in the population. Central South Africa has the highest concentration of asbestos-related complications, especially mesothelioma, which is cancer of the pleural space. It is not just the adult population that's affected. The pediatric population is as affected. The problem with the kids is they're referred hopelessly too late. By the time we see them, there's not much we can do.
Since no coordinated program to address the challenges related to heart and lung disease existed, Professor Francis Smith, head of the Department of Cardiothoracic Surgery at the University of the Free State, initiated the Wheels of Hope outreach project to address heart and lung disease in the adult and pediatric populations of central South Africa. Professor Smith explains the aims of this project in more detail.
Firstly, we have to make sure that we make diagnostic services available at the lowest possible level in our healthcare system, which is basically the primary healthcare and certainly secondary care hospitals. The second would be to make sure that the referral system is effective. And thirdly, we have to expand our services within the tertiary institutions to be able to accommodate a higher inflow of patients.
The Wheels of Hope project includes outreach initiatives to state hospitals in both Kimberley and Welkom. Dr. Richard Schulenberg from the Department of Cardiothoracic Surgery at the University of the Free State describes challenges experienced and progress being made at the Kimberley Hospital.
We're seeing a massive influx of patients. We're seeing at least 20 to 25 referrals a week with thoracic problems. It's an 18-bed ward that's permanently full. We've got one operating list on a Wednesday where we get through 5 to 6 patients, which is not enough at this stage. We've developed a thoracic surgery clinic, we've developed a specialist thoracic oncology clinic, a vascular clinic, and then I screen once a week all abnormal heart sonars by the echocardiographers. We're planning to develop the services in the Northern Cape in different phases. Phase 1 with the first 18 months, we focused on thoracic surgery. We built a service in the first year from basically nothing to doing 200 thoracotomies, and that is only the tip of the iceberg. I think we should be doing 400 to 600 thoracotomies a year. The next 18 months, we hopefully will be starting in conjunction with Life Healthcare, the cardiac services.
The Wheels of Hope project at the Bongani Hospital in Welkom includes the presenting of specialized lectures on relevant topics to hospital staff and medical practitioners in the area. Dr. Johan Jordan explains the motivation behind these lectures.
The idea behind the lectures is to give formal didactic lectures as well as academical rounds, thereby increasing the knowledge of the doctor in the periphery. They then identify the diseases earlier so that we can manage the patients earlier. The second idea is to refer the patients back to them once they have been managed or surgically treated so that they can take care of the patients afterwards, reducing the load on Bloemfontein.
As part of the outreach project, measures are also being implemented at the Universitas Hospital to fast-track referrals from hospitals outside Bloemfontein. Dr. Jordan again.
What we have created is an open clinic here at Universitas Hospital in Ward 4B. Patients are seen the following day after referral, and then they bypass the entire referral system. The hospitals can then directly send a patient to us. We will accept the patient and we send them to the relevant departments and we send them for the relevant tests so that they will be sorted out the same day.
There is a perception that projects such as Wheels of Hope have no role to play in the primary healthcare environment. Professor Smith addresses this misconception.
Despite the high-tech environment associated with pediatric cardiac surgery and certain types of adult cardiac surgery, the expectancy is that this is expensive, that it's only available to the lucky few and has no impact on society as a whole. The fact is that we are basically part of primary health care in the sense that we can get people back to work. We have a dependency figure of around about 4 to 6 per working person in our society. And if we have someone like a young woman with mitral valve disease and she has to stop working, there are 4 dependents that also end the poverty cycle. We can make a dramatic difference to that, and it's also been proven over and over again that the cheapest possible solution to an operable cardiac lesion is to have an operation as soon as possible while you still can expect an uncomplicated postoperative course.
The Wheels of Hope project includes a research component focusing on the prevalence of rheumatic heart disease amongst grade 12 learners in the Free State and Northern Cape. Echocardiography screening is performed by Salome Jacobs, clinical technologist and coordinator of the research project. Mr. Gordon Moncho, CEO of the Kimberley Hospital, highlights the importance of supporting this research project.
The Wheels of Hope project, we would want to publicly declare that we will give our full cooperation and support to this research program. Being the only tertiary facility in the Northern Cape, I think it stands us in good stead as well to be able to be part of this major development in central South Africa, to be able to measure the extent to which cardiac diseases are prevalent, especially in younger children at schools and so on. So we are really looking forward to be working with the team, but also looking forward to the results. I think that will also improve planning going forward from the side of the Department for Healthcare Provision for the people of the Northern Cape.
Future plans for the Wheels of Hope project are described by Professor Smith.
We envisage to roll out the project in a second phase to other centres in the Northern Cape like Uppington, Kuruman and De Aar, and in the Free State to Bethlehem.
Professor Smith and the project team would like to thank all role players for their commitment in making the Wheels of Hope project such a success. This includes other departments in the Medical School of the University of the Free State, as well as the Northern Cape and Free State Departments of Health and their respective MECs. A special word of gratitude also goes to the prestigious Life Health Rose Park Hospital in Bloemfontein for making available a mobile echocardiography machine. Apart from covering the transport expenses, the hospital is also providing a driver, marketing consultants, etc. for the project. The esteemed vehicle dealership in Bloemfontein, John Williams Motors and Barloworld, are thanked for making available a Mercedes Vito to transport staff involved in the project to schools and hospitals in Bloemfontein, Welkom and Kimberley. They have also taken responsibility for maintaining and servicing this vehicle. We end with a few closing remarks by the Dean of the Faculty of Health Sciences at the University of the Free State, Professor Gert van Zyl.
The Faculty of Health Sciences of the University of the Free State started more than 10 years ago with an initiative of outreach to the community. We are very proud about this initiative, and specifically the Wheels of Hope project, which will bring cardiothoracic surgery not just to the community but also to different provinces. We are supporting as faculty this project and see that this can be a blueprint in the future for outreach of academic disciplines to the community.
The Wheels of Hope project is undoubtedly breaking new ground when it comes to community outreach in the Free State and Northern Cape. This project, with its emphasis on service delivery, research and training, is in a coordinated and sustainable manner laying the foundation for successfully addressing the challenges related to heart and lung diseases in our communities.